You're listening to the ATS Breathe Easy podcast, brought to you by the American Thoracic Society.
So welcome everyone to the ATS Breathe Easy podcast with one of your hosts, Amy Attaway. And I'm here with Dr. Raed Dweik, who is this year's American Thoracic Society President. And he will be talking about his plans for ATS this year. So as an introduction, Dr. Dweik is the chief of the Integrated Hospital Care Institute at Cleveland Clinic, which oversees over 1,200 physicians and scientists in Ohio, Florida, London, and Abu Dhabi. It includes 5 departments, including pulmonary critical care. Dr. Dweik is also a physician scientist. He's a professor of medicine at Cleveland Clinic Lerner College of Medicine, has had continuous NIH funding since 2002, with a longstanding interest in pulmonary hypertension, asthma, and exhaled nitric oxide. He's also the director of multiple programs, which really promote early career scientists and physician scientists, including our KL2 program and our T32 program. So anyway, I wanted to thank you, Dr. Dweik, for being here on the podcast.
Well, thank you so much for having me.
So I think just kind of diving into some of the questions we were wondering. So I was wondering if you could reflect on your journey with ATS and kind of what inspired you to become president.
Yeah, thank you so much for having me and for the introduction. So my first meeting at ATS was when I was a fellow in 1994 in Boston. And, I think, as I mentioned in my address to the ATS, it was total confusion for me. I was completely confused. I was trying to kind of, get to sessions. I missed some sessions. But then I really haven't missed a meeting since then. So I was very inspired by the meeting, and I've been coming to the meeting now for 30 plus years. And, to me, that's the place where I meet people. That's the place where I presented my science. That's the place I networked. That's the place I met mentors. And later on, I started mentoring people as well. So to me, my journey at ATS started with that, just presenting my abstracts and my posters, etc. And then it evolved over time, which I encourage, again, everybody who wants to be involved in ATS is joining the assemblies. So I started joining the assemblies. It's a long story for me because I couldn't find the right assembly right away. So I joined one, then the other, and I moved around about half the assemblies until I settled on my current assembly, which is the pulmonary circulation. But that helped me learn quite a bit about the ATS. And then after that, really, the next phase was getting involved in committees. And committees really are a lot of where the work for ATS happens. And so once you learn about these, I really continue to be inspired by the mission of ATS to help the world breathe better. And I wanted to give more and give back. And that's why I applied and was elected as ATS treasurer, then of course president-elect, and now president. So it's a fascinating journey. I enjoyed every bit of it, but it's great to be here now.
That's great. I remember you speaking about the confusion at first, like your first meeting, which I can definitely relate to. And I feel like a lot of people probably can, just because there's so much happening at once. And I think joining an assembly really helped me as well. And I think the more just, you start to get to know people, they start to get to know you. At some point, you felt like you didn't know anyone. And now all of a sudden you feel like everyone's familiar face.
Did you miss the ATS 2025 International Conference in San Francisco? We've got you covered. With the ATS Conference Highlights Package, you can access inspiring presentations as well as valuable clinical insights from pulmonary, critical care, and sleep sessions. Members get a discount, so become an ATS member or renew your membership to take advantage of these savings. Go to conference.thoracic.org today.
One of the things we kind of wanted to ask you, because you've been secretary and then president-elect and now president, is there something that's really surprised you, kind of taking on that role that you weren't expecting?
I can say one of the surprising treats, actually, of being in the leadership and executive committee of ATS is working with the ATS staff and their leaders. This is something because I know they're helpful, because I worked with them in assemblies and committees, because they support the work of the assemblies and the committees. but just the sheer amount of work that they do and their dedication day in and day out. They support the assemblies, they support the committees, they put on this amazing conference every year. Just a beehive of activity all year long, and just to get to know them and work with them closely. It's one of these things that I think it's a privilege of being on the leadership of ATS, is get to see firsthand the ATS staff and what they do every day to support this organization. I'm just in awe in what they are capable of doing. There's nothing almost they can't do if you get the right person at the ATS. I know most of us know them through the committees and assemblies, but there's so much more work that goes on behind the scenes to make sure the ATS remains at the top of its game.
Mm-hmm. Yeah, I'm always amazed how the meeting, I mean, just the conference comes together. It's just there's so much happening, so much organization. And I think I took it for granted before, but just thinking about all the moving parts to actually make the actual conference at the end of the...
Exactly. That's how I felt before I took the leadership. Okay, the conference happens, you show up, everything is great, but then the sheer amount of work behind the scenes that happens is just unbelievable and amazing.
Mm-hmm. So, no, I totally agree. And so we were also, there's kind of similar questions, but we were kind of wondering what your vision was for ATS and maybe what are some of the challenges that you're thinking of this coming year?
Yes. So there's a great thing about ATS now as an organization is that we have a strategic framework. And that was not always the case. I remember the years early on in ATS where every president comes in and just upends the whole strategy. Now their focus is this, or our focus is that. And then all initiatives from the previous year get kind of put on hold and new initiatives get in. But a few years ago, I think some of our former presidents and executive committee members came together and decided to really come up with a strategy for ATS. Now, hopefully everybody is familiar with it. It's on our website. It's about supporting science, supporting careers, helping patients, all the things that we expect from an organization like ours. And so our strategy is set. We modify it, we tweak it every year. The executive committee with the president and the board, we adjust it based on what's going on. So that makes it kind of easier for a new president coming in. You don't have to really develop a whole new strategy just for a year because you're president only for a year. So it's not really a good idea to kind of turn the organization every year in a different direction. But I do have some things, nuances for how I want to approach our strategy. And a couple of them I think I have in mind. One is to really maintain the premier status of ATS as the premier society in respiratory medicine. And we are, and we need to continue to do there's a lot of competition out there. There are a lot of other small and large societies competing for this status. But I still believe that ATS is the place where people want to come and present their research, want to connect with their colleagues. So that's something I think it's top of mind for me to maintain ATS as the premier society. The other one is membership. I know all societies focus on membership, but I'd like ATS. I think we are like that, but I think we can do better in being a big tent where everybody feels at home at ATS. In my mind, clinicians, scientists, mid-career, early career, senior investigators, educators, clinicians, U.S., international members. I want everybody to feel this is a place where they can contribute. This is a place where they belong and they can, make a difference. So these are the two things that I'd like to focus on this coming year. And also, of course, you mentioned the challenges. There's probably every president thinks their year is the most challenging, but I think probably it's hard to argue that this year is challenging to lead anything. Whether you're leading a division or a department, an institute or an organization or a professional society, just because of the uncertainty of all what's going on around us, whether it's clinical reimbursement, funding for research, all the things that are running around. So I think that's the biggest challenge that I think uniquely face us this year. We have long-term challenges of taking care of respiratory chronic illnesses, the environment, climate, et cetera. But I think this year is unique in the fact of the uncertainty for things like research funding and clinical funding, et cetera.
Mm-hmm. Yeah, we actually, that was one of the things we wanted to talk to you about. And we actually have a podcast coming up next week with Dr. Josh Fessel about like NIH funding in particular. But I know that was the Arena, our past president, Dr. Petrarch, that was one of the things that she had kind of mentioned as president was more ATS-based grant funding. She kind of talked about the Friends of Arena program, which seemed like a great kind of way to kind of help with that funding aspect.
Absolutely. And I think that ATS can play a small role. We can't replace all the funding. Of course, federal funding is huge, but we can do our part in supporting our members. And I think here is where philanthropy plays a huge role. Our membership dues and journal income and conference income is almost just as enough to keep us running as an organization. So to give out research grants, we rely heavily on our own grants, partnering with other organizations that have money and they want to partner with us, but also most importantly, philanthropy. So I was glad to see that the research benefit at ATS was very well attended this year, and that raises money directly for research. I think it's a brilliant idea for IRENA to kind of put the Friends of IRENA out there to raise funding that's all going to go to research. And many of our members donate regularly. I see those every week, and I send thank you notes for those who donate. And that money goes directly to research. Our young investigators who really are just starting their careers, we need to support them. So as much as we can, we try to allocate money to research at ATS. Actually, this year we're allocating more than ever, just because of the fact that we did very well with philanthropy and hoping we can continue that trend and give more and more every year. So.
Oh, that's great. It was really nice to hear her talk about that in her concluding remarks, that her program. I also think going back to international membership, I think that's one of the things I really enjoy about the ATS conference is meeting people from other countries. And I always try to, if someone's like at my poster and we're kind of getting to talk about them, I always try to talk to them and, welcome them to the conference, to coming to America from their country. We were curious, you've really kind of spent a lot of your career helping early career physicians and scientists. And is there any advice? I think you had talked about that an assembly was really important to join. Do you have any other thoughts on how to support early career physicians and scientists?
Yeah, that's absolutely. I think first come to the meeting, right? If you can't come to the meeting, you're not going to meet anybody. So I think coming to the meeting every year, it would be probably the starting point. And I know at the beginning, as I said, it may be confusing to have the meeting. You miss maybe more than you attend. But the more you attend the meeting, the more you get to know the cadence and where things are and and then you start identifying your people. So this is a great place to network. So in my career, for example, I first would be presenting my science. I would be nervous. Who's going to stop by my poster? Who's going to come to my talk? But then these people you are nervous about them coming are the ones who end up helping you because they come and they see the great work that you're doing and they can help you along the way. They become mentors or collaborators. So that's something I encourage people to do. And network. Don't hide. I think some people I am an introvert by design. I know it may not seem like it now becoming ATS president, but I think it's important to get out of your shell at ATS and go to posters, go to talks, engage the speakers, engage the people who come to your posters or you go to theirs. And the ATS, to me, I've been to so many meetings over my career. I think ATS is one of the best, really, conferences for networking, especially for early career individuals, where if you are a clinician, you can meet scientists. If you are a scientist, you can meet clinicians and both. And also educators. So I think there's really no other meeting I can think of where there's such a critical mass of all of these. Because some meetings are more clinically oriented, some are more research oriented, some are more education oriented. I think ATS has all of it. If there's one meeting you want to go to, in my opinion, it's ATS. It's just because of the diversity of the attendees and just the sheer volume and number of people who come. And as you mentioned, the places they come from. It's an international conference. People come from all over the world. And as I travel, actually, to other society meetings, one of the biggest requests for them is they want to come more to ATS. I was just in Japan recently. They were asking, I think you were together in Japan, and they were one of the big sessions there. Amy, I know you gave a great presentation. There is more of them want to come to ATS. They worry about the language barrier. So we help them. Okay, like how can we help them with that? I go to went to a couple of meetings in South America. The same thing. Everybody recognizes ATS is the place to be. We need to identify their barriers and make sure to lower them. That's our role as leadership in ATS, is to make sure it's easy to come to ATS.
Mm-hmm. Yeah, I was so impressed. So, I mean, there's with our international members, sometimes there's a language barrier. So that's even harder, like to know all those scientific words and putting yourself out there. I'm always really impressed when I see these scientists from other countries really come to ATS, and I'm really excited that they're there. And I agree. I think the more if you're an introvert, the more you go to conferences and kind of put yourself out there, I think you just kind of get used to it. That's my 2 cents.
Absolutely. Just do it. Practice. Just to get out of your shell and talk to people. And you'll find quickly that it's not that scary.
Yeah. We did want to ask you, because I think at ATS, the San Francisco one, we saw you and Arena in Waymo, the driverless.
Yeah, that was a lot of fun. Yeah.
Yeah. So we were kind of wondering if you had any things you're excited about in technological advancements in the field.
Yeah, it's funny that you say that. Actually, in Arabic, my name, one of the meanings has multiple meanings, but one of them is pioneer. Somebody who really just goes ahead of the game. So maybe there's some science saying that the name may affect the person. I don't know. Maybe it does. Maybe it doesn't. But I do like to explore new things. I am an early adopter of technology. Of course, then if it doesn't work, you move on. But at least you know if it works or if it doesn't work. So when I saw the Waymo cars in San Francisco on the way from the airport, I said, I gotta get one of these. Literally the same day we got in one with Irina, and it was a lot of fun. So that's really, I think technology, there's a lot happening. And I briefly attended the Respiratory Innovation Summit at ATS, which starts before the meeting. And there's so much going on there, whether it's technology or new drugs or biologics. So the field is exciting now. I think in the field of pulmonary and respiratory medicine in general, whether it's AI related or it's new compounds. So I think really there's so many things going on. I'm very, very excited about, there are disease-modifying drugs coming up for pulmonary hypertension and ILD. There are biologics now. Asthma biologics are established, and there are new ones coming all the time. Bronchoscopy, like lung volume reduction surgery, and endoscopic. There's so many of those things, and AI in critical care is taking off. It's almost like the list continues to grow every day, and I think these are very exciting times. Of course, it remains to be seen what works and what doesn't, but that's how it goes.
Mm-hmm. Yeah, that was. We've actually had 2 podcasts on AI in medicine. So I think first was from the perspective of how you do your research or how your manuscript writing, things like that. But then the other one was in medical care. And so I think, I mean, it's only, to me, I just attended this, the multi-omics workshop, and AI is just kind of, to me, it seems like it keeps accelerating, like the technology. So,
even here, they've deployed a couple of AI things. We have a module of AI to detect sepsis early, for example. It's already deployed here. It's an AI model. We have a model to assess preoperative risk and how to determine, what kind of care you need pre and post-op. So this is here to stay, of course. AI is here to stay. And I think it's a matter of, my approach to all these new technologies is, how can what problem it solves for us. I think I like it when I have a problem and I find a technology or AI solution to it. I struggle when a company comes to me, it happens often, is they have a solution looking for a problem. It's like, we have this product, can you use it? It's like, you could have checked with me before. So I think early involvement, of our physicians and scientists in technologies would help us get better technologies. I think it's better to have a solution for a problem than have, start with the problem and find a solution instead of starting with a solution and then go shopping for a problem, which I think is more common than I like to see.
Mm-hmm, mm-hmm. I agree. We also have the AI helps with the charting. Like it will kind of listen and will
Have you used it? This AI Scribe,
Yeah.
have you used it? Yeah, it's amazing, actually.
Yeah. I think it's very good for some things, especially like in giving patients instructions. So I do like it for that. But I think you definitely have to double check it.
Yeah,
So
of course.
some oversight, I think, with AI, of course, is important.
It's good advice.
Yeah. Is there anything you're already planning the next meeting in Orlando? Is there anything to mention about that, or?
So Orlando is going to be exciting. So I want to encourage everybody to make their plans, submit their posters, your abstracts, your ideas for Orlando. I think we haven't been there in a while. I think it's going to be exciting. Hopefully, makes it easier for many of our European colleagues to come over as well because it's closer to them for flights. But of course, we'll have the same outstanding conference we always do, which is all the things that we're expecting: the poster sessions, the plenary sessions, and all the speakers and the poster discussions. I'm hoping that we'll try, of course, the planning is just happening right now. And of course, it's done by the conference chairs. So the executive committee and the president are more of play an advisory role to the committee, to the conference chairs. But I'm hoping that by then in Orlando, we'll have some ideas of how to help our members navigate all this uncertainty that's happening in around us in medicine and in the world. And as I think mentioned in my presidential address in San Francisco, is we seem to be surrounded by crises now. It's like one crisis after another. And I use the Chinese wisdom there, where the word crisis actually in Chinese is made of two symbols, one for opportunity and one for danger. So I think while we're surrounded by all these crises, I think there are also opportunities for us as an organization to step up and support and help our members and try to make sense of all the uncertainty that is surrounding us. But that takes really us as an organization, but the members to engage as well. And I think one thing I closed my remarks with is it's fair for all of us to ask what ATS can do for us, but I like also members to think what they can do for ATS. It's very important, I think, for us as members to support and sustain ATS as an organization so it's around for generations to come, for our future clinicians, scientists, and educators in the respiratory field. And I think it's an obligation for us to maintain the organization and make sure ATS thrives moving forward.
Mm-hmm. Yeah, I've always appreciated the sense of community. So even if we have these challenges, at least we can talk to each other, communicate with each other, and plan. That kind of helps if you have your network on how to deal with these issues. So that's one of the things I've always really appreciated about ATS.
Absolutely.
Is there anything else you wanted to discuss, or?
I think that's good. We addressed a lot of other things. There's a lot to talk about. I can talk about ATS all day long, I think, but I think we definitely hit the high points. And really, I want to encourage people, at this time, not to be discouraged. I encourage them not to be discouraged. It's especially for the researchers out there that they feel the pinch of NIH funding issues. Somebody's going to get funded. It might as well be you. That's what I tell my trainees and mentees is, just, don't give up. Just keep trying. Persistence pays off. And somebody is going to get funded. It might as well be you. So keep up the good work and keep putting your nose to the grindstone. Do good science, good patient care, education, whatever your field is. Just keep at it and focus on your job and your career, and everything will be okay.
Thank you. That's really nice to hear, I think, for all of our members. So thank you, Dr. Dweik, for participating in our podcast. And then just to give a quick plug, so next week we will actually be speaking about the NIH cuts and grant funding, their impact. So we'll have guests Dr. Josh Fessel and Sade Afolabi. So looking forward to hearing that next week.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more ATS Breathe Easy podcasts on Transistor, YouTube, Apple Podcasts, and Spotify. Don't forget to like, comment, and subscribe so you never miss a show.